Section 1. The sunshine vitamin. More than just a nutrient. Vitamin D, often dubbed the sunshine vitamin, is not just another nutrient. It's a powerful hormone precursor with far-reaching effects on our health. Unlike other vitamins that our bodies rely on from dietary sources, vitamin D can be synthesized by our skin upon exposure to sunlight. This unique characteristic highlights the intimate relationship between our bodies and the environment, emphasizing the importance of sunlight for our overall well-being. However, modern lifestyles often limit our sun exposure, leading to a silent epidemic vitamin D deficiency. The consequences of inadequate vitamin D levels are vast and can silently impact various bodily functions. From bone health, which is commonly associated with vitamin D, to immune function, mental health, and even chronic disease prevention, the influence of vitamin D is undeniable. What makes this deficiency even more concerning is its often subtle presentation. Many individuals remain unaware of their low vitamin D levels, attributing mild symptoms to stress, aging, or other factors until more serious health issues arise. Section 2. The root of the problem. Why are we deficient? Vitamin D deficiency has become increasingly prevalent in recent decades, impacting a significant portion of the global population. This widespread deficiency can be attributed to a confluence of factors, ranging from lifestyle choices to geographical location. One primary contributor is the reduced amount of time we spend outdoors, exposed to natural sunlight. Modern work environments, indoor entertainment, and concerns about skin cancer have led many to minimize their sun exposure, inadvertently impacting their vitamin D production. Furthermore, our skin's ability to synthesize vitamin D from sunlight varies depending on factors like age, skin pigmentation, and latitude. Older adults and individuals with darker skin tones require longer sun exposure to produce the same amount of vitamin D as younger individuals or those with lighter skin. Similarly, people living in higher latitudes or areas with limited sunlight hours are more susceptible to deficiency. Dietary sources of vitamin D are limited, primarily found in fatty fish, egg yolks, and fortified foods. While a balanced diet can contribute to vitamin D intake, it's often insufficient to meet the body's requirements, especially in individuals with limited sun exposure. This is particularly true for those following specific dietary patterns, such as veganism or vegetarianism, which may further restrict their intake of vitamin D-rich foods. Certain medical conditions and medications can also interfere with vitamin D absorption and metabolism, increasing the risk of deficiency. Individuals with conditions like celiac disease, Crohn's disease, or cystic fibrosis may experience malabsorption of vitamin D in their intestines. Similarly, medications such as steroids, weight loss drugs, and some cholesterol-lowering medications can affect vitamin D levels. It's crucial to discuss any underlying health conditions or medications with a healthcare professional to assess the risk of vitamin D deficiency and determine appropriate preventive measures. Section 3. A silent epidemic. Vitamin D deficiency in children. Vitamin D plays a critical role in childhood development, particularly in bone health and immune function. During the crucial years of growth and development, adequate vitamin D levels are essential for calcium absorption, ensuring strong bones and teeth formation. A deficiency in vitamin D during childhood can lead to rickets, a condition characterized by soft and weakened bones, skeletal deformities, and delayed growth. Beyond its impact on bone health, vitamin D deficiency in children has been linked to an increased risk of infections, particularly respiratory infections. Vitamin D plays a crucial role in regulating immune responses, and a deficiency can weaken the body's defense mechanisms, making children more susceptible to infections like colds, flu, and ear infections. While rickets is a severe manifestation of vitamin D deficiency, more subtle symptoms may often go unnoticed or be attributed to other factors. These include muscle weakness, bone pain, delayed walking or motor skill development, and increased susceptibility to fractures. Recognizing these subtle signs is crucial for early intervention and prevention of long-term consequences. Addressing vitamin D deficiency in children requires a multifaceted approach, encompassing adequate sun exposure, a balanced diet rich in vitamin D-rich foods, and supplementation when necessary. Parents and caregivers play a crucial role in ensuring children receive adequate vitamin D through a combination of these strategies. Regular checkups with a pediatrician can help monitor vitamin D levels and address any deficiencies promptly. Section 4. The adult burden vitamin D deficiency across the age spectrum. While vitamin D deficiency is a significant concern during childhood, its impact extends throughout the lifespan, affecting individuals of all ages. In adults, chronic vitamin D deficiency can have far-reaching consequences, contributing to various health issues, some more apparent than others. One of the most well-known consequences is osteoporosis, a condition characterized by weakened bones, making individuals more susceptible to fractures, particularly in the hip, spine, and wrist. Beyond bone health, vitamin D deficiency has been implicated in a growing list of health problems in adults. Research suggests a link between vitamin D deficiency and an increased risk of certain cancers, including colorectal, breast, and prostate cancer. Additionally, studies have shown an association between low vitamin D levels and an increased risk of cardiovascular disease, including heart attack and stroke. The symptoms of vitamin D deficiency in adults can be subtle and easily mistaken for other conditions. Fatigue, muscle weakness, bone pain, and joint pain are common complaints. Individuals may experience depressed mood, sleep disturbances, and impaired wound healing. These vague symptoms often lead to misdiagnosis or delayed treatment, highlighting the importance of considering vitamin D deficiency as a potential contributing factor to various health concerns. Given the widespread prevalence of vitamin D deficiency and its potential health consequences, it's essential for adults to be aware of their risk factors and prioritize maintaining adequate vitamin D levels. This includes incorporating lifestyle modifications, such as spending time outdoors, consuming a balanced diet rich in vitamin D-rich foods, and considering supplementation when necessary. Regular health checkups and discussions with healthcare providers can help identify and address any deficiencies promptly, promoting overall health and well-being. Section 5. Unmasking the deficiency diagnosis and the 25-OHD test. Diagnosing vitamin D deficiency relies on a simple yet powerful tool, the 25-hydroxyvitamin D blood test, commonly known as the 25-OHD test. This test measures the level of 25-OHD, the primary circulating form of vitamin D in the bloodstream, providing a reliable indicator of an individual's vitamin D status. Healthcare professionals use this test to identify deficiencies, monitor treatment effectiveness, and ensure patients maintain optimal vitamin D levels. While symptoms like fatigue, bone pain, and frequent infections may raise suspicion of vitamin D deficiency, they are often non-specific and can be attributed to other conditions. Therefore, relying solely on symptoms for diagnosis is unreliable. The 25-OHD test provides an objective measurement, enabling healthcare professionals to make accurate diagnoses and tailor treatment plans accordingly. The 25-OHD test is a simple blood test that can be performed in most healthcare settings. It involves drawing a small amount of blood from a vein, typically in the arm. The blood sample is then sent to a laboratory for analysis. Results are usually available within a few days. Interpreting the results of the 25-OHD test involves considering the reference range provided by the laboratory and the individual's specific health status. Recognizing the limitations of self-diagnosis and the importance of personalized medical advice is crucial. If you suspect you may have a vitamin D deficiency, it's essential to consult a healthcare professional. They can assess your individual risk factors, order the appropriate tests, and recommend the most suitable course of action, ensuring you receive the personalized care you need to achieve and maintain optimal vitamin D levels. Addressing vitamin D deficiency involves a multifaceted approach tailored to the individual's specific needs and deficiency severity. Treatment strategies typically encompass lifestyle modifications, dietary adjustments, and supplementation, often used in combination to achieve optimal results. The primary goal is to replenish the body's vitamin D stores, improve calcium absorption, and mitigate the health risks associated with deficiency. Lifestyle changes can significantly impact vitamin D levels. Encouraging individuals to spend time outdoors, exposing their skin to sunlight, remains a fundamental approach. Even short periods of sun exposure without sunscreen during peak hours can contribute to vitamin D synthesis. However, balancing sun exposure with skin cancer prevention is crucial. Individuals should consult their healthcare provider for personalized guidance on safe sun exposure practices. Dietary interventions focus on incorporating foods naturally rich in vitamin D or fortified with this essential nutrient. Fatty fish, such as salmon, tuna, and mackerel, are excellent sources of vitamin D. Other dietary sources include egg yolks, cheese, and fortified foods like milk, yogurt, and orange juice. Encouraging a balanced diet rich in these foods can contribute to maintaining adequate vitamin D levels. Supplementation plays a crucial role in addressing vitamin D deficiency, especially when lifestyle changes and dietary interventions are insufficient. Vitamin D supplements are available in two forms: D2, ergocalciferol, and D3, cholecalciferol. D3 is the form produced by the skin upon sun exposure and is generally more effective in raising blood levels of vitamin D. Healthcare professionals determine the appropriate dosage and duration of supplementation based on the individual's age, health status, and severity of deficiency. Harnessing the power of sunlight offers a natural and readily available method to boost our vitamin D levels. Our skin possesses a remarkable ability to synthesize vitamin D upon exposure to ultraviolet B, UVB rays from the sun. This process, often referred to as making vitamin D, highlights the interconnectedness between our bodies and the environment. However, several factors influence the efficiency of vitamin D synthesis from sunlight, and understanding these nuances is crucial for maximizing its benefits while minimizing potential risks. The amount of UVB radiation reaching the Earth's surface varies depending on the time of day, season, latitude, altitude, and weather conditions. Generally, UVB rays are most intense between 10 a.m. and 3 p.m., particularly during the spring and summer months. Individuals living closer to the equator receive more direct sunlight and therefore have a greater capacity for vitamin D synthesis compared to those living in higher latitudes. While sun exposure offers a natural source of vitamin D, it's crucial to balance its benefits with the potential risks associated with excessive UV radiation, such as sunburn and skin cancer. The amount of sun exposure required to produce sufficient vitamin D varies depending on individual factors like skin pigmentation, age, and geographical location. Generally, short periods of sun exposure, typically 5 to 30 minutes to the face, arms, and hands twice a week without sunscreen, are sufficient for most individuals to maintain adequate vitamin D levels. However, it's essential to prioritize skin protection and avoid excessive sun exposure. Prolonged sun exposure, especially during peak hours, can increase the risk of sunburn and skin damage. When spending extended periods outdoors, protective measures such as wearing sunscreen with an SPF of 15 or higher, protective clothing, including hats and sunglasses, and seeking shade during peak hours are crucial for minimizing UV radiation exposure. While sunlight and diet are valuable sources of vitamin D, supplementation often becomes necessary to bridge the gap and ensure optimal levels, especially for individuals at risk of deficiency. Factors such as limited sun exposure, dietary restrictions, malabsorption disorders, and certain medical conditions can hinder adequate vitamin D intake, necessitating supplementation to maintain optimal health. Vitamin D supplements are available in two primary forms: D2, ergocalciferol, and D3, cholecalciferol, each with its own characteristics and efficacy. Vitamin D3, also known as cholecalciferol, is the form of vitamin D that our bodies naturally produce upon sun exposure. It is generally considered more effective in raising and maintaining blood levels of vitamin D compared to vitamin D2. D3 supplements are typically derived from lanolin, a substance found in sheep's wool. Vitamin D2, or ergocalciferol, is produced by plants and is the form of vitamin D commonly added to fortified foods. While both D2 and D3 supplements can raise vitamin D levels, D3 is generally more potent and longer lasting in the body. The choice between D2 and D3 supplements may depend on individual preferences, dietary restrictions, vegan or vegetarian, and the specific recommendations of a healthcare professional. Determining the appropriate dosage of vitamin D supplementation is not a one-size-fits-all approach. Factors such as age, health status, existing vitamin D levels, and individual risk factors influence the recommended dosage. It's crucial to consult a healthcare professional to determine the appropriate dosage and duration of supplementation to avoid oversupplementation and ensure optimal health outcomes. Vitamin D, often referred to as the sunshine vitamin, is much more than just a nutrient. It's a powerful hormone precursor with profound implications for our health throughout our lives. From supporting bone health and immune function, to influencing our mood, energy levels, and risk of chronic diseases, vitamin D plays a multifaceted role in our overall well-being. Recognizing its importance empowers us to make informed decisions regarding our lifestyle choices, dietary habits, and healthcare practices. Embracing a proactive approach to maintaining optimal vitamin D levels involves a combination of strategies tailored to our individual needs. Spending time outdoors, engaging in regular physical activity, and consuming a balanced diet rich in vitamin D-rich foods are essential pillars of a healthy lifestyle that supports vitamin D sufficiency. However, modern lifestyles often present challenges to obtaining sufficient vitamin D from sunlight and diet alone. Factors such as limited sun exposure, geographical location, dietary restrictions, and certain medical conditions can hinder our ability to maintain adequate levels. In such cases, vitamin D supplementation, under the guidance of a healthcare professional, becomes a valuable tool to bridge the gap and ensure optimal health outcomes. Regular checkups and open communication with our healthcare providers are crucial for monitoring our vitamin D status, identifying potential deficiencies early on, and receiving personalized guidance on maintaining optimal levels. By understanding the significance of vitamin D and embracing a proactive approach to its maintenance, we empower ourselves to live healthier, more vibrant lives, basking in the benefits of this essential nutrient.